The No One Dies Alone program came about out of a shared leadership patient care council, where a volunteer as well as a staff member from our pastoral care were involved on that committee. The staff who value and honor the life of every patient expressed concern that they were not able to always be with the patient at the end of life. Death was imminent, and they were just unable to spend the time that the undetermined amount of time that it would be for the patient to pass away.
Reality is that there were a certain number of patients that were dying alone. And there was this belief that a part of our respect for the dignity of patients is to say no one should die alone, if possible. That we should be able to be there and make that connection just as we make that connection throughout life. One of the things, if you ask patients what they're most afraid of, it's dying alone and dying in pain. And so as a result of that, we really have a need for people to be connected, because so much of the dying process involves alienation, involves isolation.
So how a companion is called upon to be with the patient in the last hours or minutes of their life is really a collaborative effort between our pastoral care, our nursing staff, and our volunteers. It's amazing the response when a call is made for a compassionate companion. They reprioritize their life immediately, and within 30 minutes of time, there is a compassionate companion at the bedside.
As I always tell families, nothing is ever on our time when it comes to dying. It's always on God's time, but God will be on time. And so the volunteers are there to be on God's time. And so they're just there to be with them, to be present, to hold their hands. It gives not only family members great comfort that we have a volunteer in there with the patient, but it gives us as chaplains and nurses and other healthcare workers a sense of comfort, because we know that no one dies alone. So it's a great gift to the staff here at the hospital. So we oftentimes think of it just in terms of the patient and the families, but it's really been received well here precisely because it's also a gift to us, because much as we'd like to as caregivers be there all the time, we can't be realistically. And so these volunteers fill such an important role in terms of that.
This program is all about our mission. Our volunteers are the healing presence of God with this ministry.